Hello everyone, myself Dr. Himanshu, and I have created this short video to just give an idea about how to prepare for DNB Pediatric Practicals. The dates has been announced from NB, it's on 10th of December 2022, so still ample amount of time is there, almost more than 1 month is there, sufficient amount of time to prepare for practicals. First, let's take a brief idea about what is the current pattern of pediatric practicals, especially for those who are appearing for first time. I would just like to let you know that the practical of pediatrics, DNB Pediatrics, has been divided into two main sections. One is virtual OSCE, Objective Structural Clinical Examination, which has been implemented in practicals since COVID era, and they have continued with this pattern now also. So the total DNB practical is of 300 marks. Out of that, 100 marks is for the OSCE pattern and 200 marks for remaining pediatric practicals. So what is OSCE? How it has been conducted? It's like image based. Most of the questions are image based, and some few questions are not image based, so they are from some clinical scenarios or biostatistics. So they give you 20 questions. It's on projector throughout India. Same questions are there for each and every center where practical has been conducted. So one question will be projected there. They will give you around 4 minutes for a single question. Each question carries 5 marks. There are total 20 questions, so 100 marks for OSCE. So the question will appear on this projector, and you have to answer on the answer sheet. They will give answer book, separate paper for each and every question. So like when the exam starts, they will give you 20 papers. You have to write your details, your roll number and everything on that 20 papers, 20 answer sheets. And like first question has been displayed, you have to give answer of that first question in the given stipulated 4 minutes of time. And they will take that answer sheet of that question number 1 just after completion of the time for that question. So you guys won't be having any extra time after completion of all the 20 questions that you will able to complete if you are leaving some questions behind. So target should be, if you are getting question number 1 on the display, complete each and everything. Don't leave any point. Just answer all the questions. Like a single question can be divided into 4 or 5 parts usually, because one question is of 5 marks. So usually it is divided into 4 or 5 sections. Or any X-ray based question is there, so 4 or 5 X-rays can be there. Or if they have given an image of MRI, they will ask about the diagnosis and about the treatment or anything like that. So you have to be open-minded, sharp-minded there. Presence of mind is very much important. Questions are not very tough, not very easy. It depends. Few sessions they have given standard questions. Few sessions the question level were quite difficult. But difficulty level is same for everyone, and our aim should be to attempt each and every question properly. First, how to prepare for OSCE, that we will take in another lecture or later on this video. But this is the pattern of OSCE. So 20 questions, each question you will get only 5 minutes. First question, we have to write all the answers, copy will be taken by the invigilator, then second question will be displayed on the projector. You have to attempt that question, and like that for all the 20 questions. Okay, the other part of the practical is clinical cases, 2 major cases, 50 marks each. So 2 into 50 is 100 marks of the clinical cases. Those 2 major cases are from mainly CVS, CNS, or nutrition part, like SAM, severe acute PEM cases, severe acute malnourishment case, or even from hematology they can ask. So any system can be asked, but usually in most of the centers where exam has been conducted, they take major case from either CNS or CVS mostly. So CNS can be TB meningitis or cerebral palsy. Most of you guys will get any one out of those 2. And CVS usually any congenital heart disease or rheumatic heart disease if the center have those patients available. So in severe acute malnourishment, usually if they're government medical college, there will be plenty of SAM cases admitted in NRCs. So one of the case will be SAM. Or hematology, if a center has good hematology department, they might keep like leukemia or some hemat cases. So this is for those 2 clinical cases, 50 marks each. Another part of the practical exam, pediatric practical exam from DNB, is ward rounds. Ward rounds means Usually what MD people have short cases, and DNB has tagged that as ward rounds. So 4 ward rounds, either examiner will take you to the respective wards near those 4 patients, or they will call those 4 patients on the examination area only, and they will ask, they will give a very little amount of time for history, and it's like just spot examination, and they will ask questions about that. So those ward rounds cases are mostly short cases, like they will give you thalassemia or nephrotic syndrome, lung abscess, pneumonia, any hepatitis case, or anemia, hepatosplenomegaly. These are the common cases which in mostly take only, they will give only 4-5 minutes or even 2 minutes for just quick history taking and examination, and they will ask questions simultaneously. So these are the 4 ward rounds. It comprises of 40 marks, 10 marks each. Last one is the table viva or viva voci, in that there are 4 sections, 4 tables. Each table will give you 15 marks, so total 60 marks for table viva. And in table viva, the first is for NRP, neonatal resuscitation. Mostly the questions, the mannequin will be there, and they will ask questions about the latest neonatal resuscitation protocol. So NRP should be thoroughly read, latest edition, 8th edition of NRP. And with that, they can even ask some questions related to neonatology also. Then drugs and vaccines. The next table is usually of drugs and vaccines, the most commonly used drugs. You should know the mechanism of action, indication, contraindication, side effects for drugs and vaccines as well. Vaccines, usually just keep in mind, I will discuss this later also, but vaccines, they are fond of asking rare vaccines which are not used very frequently, like every one of you know about DPT or BCG or OPV vaccine, but usually they will ask you about pneumococcal or meningococcal, which are newer vaccines, or meningococcal which is not used in universal immunization program or national immunization program. So go thoroughly for the vaccine part. Next table is usually of X-rays and ECGs. They will give some X-ray pictures or ECG pictures or any other images like that, or any clinical scenarios. So 1 or 2 X-ray, 1 or 2 ECG. They will ask about the interpretation, and they can take viva further about the diagnosis or management of that particular disease which has been shown in X-ray or ECG. Like if you get ECG of PSVT, they will ask you about how to manage PSVT, or if they give you X-ray of pneumothorax, they can ask about the causes of pneumothorax or how to proceed as per the management guideline. And one more table will be there, that is mostly of nutrition, all the nutritional aspects, all the nutrition things like all the grains and everything they will keep there. They will ask viva on that only. So this is the basic structure of DNB Pediatrics examination, practical examination. In my next video, I will take in detail about how to prepare for each section properly, and what exactly the pattern is for all these parts. Okay, thank you very much for the patience. Try to share this video with your friends or colleagues preparing for DNB practicals. Thank you, all the best.